Hey y'all, so moving on to the health and illness chapter in chapter 14 in the real world. So at the beginning of the semester, you all found out what my specialty was, and my specialty is medical sociology, so you're getting 2 videos here, and you just kind of have to deal with it. So let's get started. The sociology of health and illness. Our bodies are social objects, and it is important, it's so important for us to understand the role that health and illness plays in our lives, right? So sociologists, when we look at this, we're not looking to treat or cure anybody. We do, however, want to understand the social context of health and illness because, and if you haven't figured out what I'm about to say yet, maybe it's because we're online, maybe it's because I'm not beating it into your brains like I would have been in the classroom, but health and illness are complete social constructions. Who gets to determine what health looks like has changed over the years. How we define illness is always rapidly adjusting. And so that's kind of what we're going to be talking about over these 2 videos is sort of the social construction of health and illness. Okay? So health is this idea of a complete state of physical, mental, and social well-being. I usually ask everybody in the classroom how many of you are healthy, and then I ask you how many of you are healthy based off this definition, and almost all the hands go down because it's getting close to the end of the semester when we start talking about this, and most people's mental and social well-being, even if their physical well-being is perfect, are not looking that great, right? So maybe right now none of us are feeling so hot, or maybe you're watching this video after you've gotten used to it and you've gone on a walk. I don't know. But health is this idea of not just the physical, but also the mental and the social well-being. Healthcare is any activity intended to prove health, and medicine is the institutionalized system for the scientific diagnosis, treatment, and prevention of illness. So those are just some key definitions I need you to know for this chapter. So a disease is a condition that prevents the body and mind from working normally, and so we have different types. We've got chronic, which are long-term, and acute, which strikes suddenly. So chronic diseases are things like COPD and asthma and diabetes, and acute, you could consider that a heart attack, right? Now, if you have cardiovascular disease and it causes a heart attack, it gets a little hairy, right? But you can kind of determine the difference between the chronic and acute, right? So now, one of our best global markers for good health is something called the infant mortality rate. It is how many out of 1,000 births before the age of 1 year old does a child die, right? There are medical causes for the infant mortality rate and environmental causes for the infant mortality rate. Medical causes are things like access to healthcare, prenatal vitamins, things like that. Environmental causes are, how healthy is your environment around you. And so the worst, these are fairly updated statistics, I think, from at the end of last year. So the highest infant mortality rate we have is Afghanistan, second Somalia, and third the Central African Republic. And then our lowest infant mortality rates start in Iceland, then Japan, and finally last we have Monaco. The United States, 170 out of 225. Not looking too great, right? Not looking too great. We consider ourselves to be this amazing, great nation. And our infant mortality rate, one of our markers for global health, is shit. So yeah, let's look into it a little deeper, shall we? In the United States, oh no, what happens here? Our infant mortality rate is 5.9 out of 1,000 births, but when we start looking at things based on race, we have 4.9 for whites and 11.4 for black. So this is starting to show you where these disparities are coming from, yeah? Now, this is also when we play with Alabama, because we are a school in Alabama, so let's just see how we think good or bad. I don't know, I'll let you decide. Ooh. So the Alabama infant mortality rate for white people is 5.8. For black people, it is 14.3. We are a part of the Black Belt down here in Alabama, and you can see the medical and environmental causes going into the infant mortality rate between whites and blacks in the Deep South, right? So both of those have answers to them. Okay. Now, epidemiology. This is the study of patterns of disease to understand illnesses and how they spread and how we know to treat them and fix them. And this is a real hot topic right now for the reason why we're online, right? So just a couple of definitions for you. Your book does not give you this one. An endemic, which is just the constant presence of a disease in a known geographic location. And then we have things like an epidemic, which is the number of cases is above what we're used to seeing. And then a pandemic is when the epidemic starts to cross borders. And it's a hot topic word that we've got going on for us. So these are the deadliest pandemics in history, right? So smallpox is the biggest one. Measles is really close behind. The Spanish flu is after that. Just to put it into some perspectives, and this perspective does not mean you then get to ignore all of the things that we are currently doing with the coronavirus and COVID-19, but our current total death in the world, according to Johns Hopkins, is 14,366 people, versus all these other much bigger pandemics that we've experienced. And this is why you see all of those, the social distancing. It's really just physical distancing. But the idea of flattening the curve, and if we flatten the curve, then hopefully we don't end up with a problem in terms of our ability to treat people and whether or not our healthcare services flounder because we're overrunning the hospitals. Okay, so I'm going to give you a very, very brief attempt at a history of medicine in the United States for the rest of this video. So early medicine spanned between three areas: domestic, professional, and lay. Domestic, it was really the women of the household or a religious institution sort of helping with treatment. And we are talking very old history of medicine in the United States. We also had professional medicine, but when we were first created, the United States was very anti-professions because, you know, that was stuff that Britain was doing and we couldn't do anything that they were doing. You know, we started our own country and everything. Not like there was one already here that was kind of handling the medicine themselves, and then we showed up with the smallpox, which was that pandemic, and oh no, yeah. So this is how these things happen. And then we have lay medicine, which was midwives and you know, native medicine, men and women. So then we end up with the physicians, right? And so physicians in the United States, when they first showed up, because, you know, America was kind of anti that whole profession, started in a much lower class than patients. They were making house calls. And so they would spend all the effort and the money up front to go and help people because they had the knowledge to do so. And so often doctors were much lower classes than the people that they were treating. And then we developed the AMA, the American Medical Association. And this is where things get interesting, shall we say. They tried to create standards because during this time we had a lot of people claiming to be doctors. Hello, Dr. Pepper. We had people creating all those patent medicines and tinctures, selling essentially just cocaine and marijuana and heroin to you with a little bit of alcohol and some sugar. But we had a bunch of people sort of wandering this planet selling healthcare to people. And the AMA was created to sort of set standards as to who could be a doctor and why. And so this is how we set the standards for medical schools. And you have to go to medical school to become a doctor, and you have to go to an accredited medical institution to become a doctor, right? Excuse me. But it also set up no competition, right? So doctors were the only ones that could do medicine, which meant midwives had to kind of go. Any sort of native medicine healers had to go. Doctors sort of ran the game. And they also put sanctions on hospitals and health departments. And they said, the government doesn't know what we're doing. We are the only ones that know what's going on. So only follow doctors. And they were one of the largest lobbying groups for a very long time, and for better or for worse. You'll see in a little bit. Hospitals, they originally started as run by trustees, and so basically just wealthy people who wanted a tax haven. We called them almshouses. It was just charitable paternalism. I have all this money and I've decided that I know what's best for you. So you go live in this home over here, this giant place. And it really just housed the poor, and then everybody got sick, and then the poor died. It was working real great. And then physicians started taking over hospitals when we had a scientific shift. And they said, no, we're the ones that know what to do with treatment, how to do treatment, what's best in the protocol. And so physicians sort of took over the charge of hospitals, and then they weren't really good at money. And so then we ended up where we're at today, where there's an administrator, right? It's kind of a corporation, even though a lot of hospitals are nonprofit. It is set up very much like a corporation and changed and pushed more towards efficiency, rather than what is the needs of this patient. And then finally, the public health. Public health originally was set up as dispensaries. They referred to them as medical soup kitchens, where you could just kind of show up and say what's wrong with you, and they would hand you drugs, and then you would leave. And really, this was during the Industrial Revolution, y'all. So it was this attempt to keep people out of poverty, and if we could keep you healthy enough to go work, then you wouldn't slip into poverty. I don't know if that idea is a good idea for today. You know how healthcare can put you into poverty. It's fine. Then we also got the development of our health departments, and this was mandated after the Civil War because we had a very big problem with yellow fever and cholera. And this is how we ended up with the National Board of Health. And while we have the National Board of Health, and they're the ones that are telling us to limit our access, and some places it's a shelter in place altogether, they're the ones making those decisions. Our medical institution at large is not at all managed or run by them the way that it could be. It is mostly run by our major industries in healthcare, like insurance and prescription drugs and the AMA, right? Okay, so national healthcare in the United States. Why don't we have one? It's a really great question because all the other industrialized nations do. And we've got some really interesting things here. So between 1914 and 1945, remember I told you the AMA really didn't like competition, and if the government set the prices, then they couldn't set the prices of what they wanted to charge. We were terrified of the socialists. We decided instead to pick unions, totally not socialism. Unemployment insurance, also definitely not socialism. And life insurance and Social Security, you see where I'm going with this. All of those things are socialistic things, right? And then America entered World War II, and one of the first countries that instituted a national healthcare system was Germany. And we were fighting Germany, and so that was one of many reasons why we chose not to have a national health care in the United States. And then we got the Patient Protection and Affordable Care Act of 2010, and it did amazing stuff to our healthcare system. Was it the best thing that we could have done? No. But it really did start to change things, and so you couldn't have pre-existing conditions could not prevent you from accessing health insurance. You couldn't be denied or dropped or have lifetime limits. Some insurance company prior to the ACA, or also known as Obamacare, would drop you after spending so much money via health insurance. And for people that had severe chronic conditions, they could spend it so quickly, right? 80% of premiums had to go to healthcare and not CEOs, which was totally what was happening before this. And we had to push more towards preventative care. You couldn't deny people's children from getting access. And then we also limited the gender charge on the Affordable Care Act, and the gender charge was essentially women got charged more than men did. Or just for the fact of being a woman was considered a pre-existing condition. So this is our overall, how we ended up with the healthcare system that we have today, why we ended up in this place, and there's a lot more of this that you could read if you want to in the book I have down here referenced from Starr in 1982. I think I have a copy of it in my office whenever we get back to school. So if you're interested in it, let me know. Okay, so we've got a couple of approaches to medical treatment before we're done here. We have curative and crisis medicine, preventative medicine, and palliative care. Curative medicine is just treating a problem after it starts. Preventative medicine is trying to keep a problem from happening, and palliative care is really end-of-life care, and, you know, when you're going through severe treatments. There's one more little thing we got over here, complementary and alternative medicine, also known as CAM. You can get a medical degree in CAM now here in the United States. We've got some old and some new complementary and alternative medicine, and I'll go ahead and tell you there's a lot of research on the old, not shit worth of research on the new. So maybe be very good consumers of your healthcare, because Gwyneth Paltrow and goop and juice cleanses. None of those things can help you. However, there has been a lot of research on acupuncture and Ayurveda and yoga. So you just need to find an expert when you look into these things instead of reading blogs on the internet. Oh, goodness.